You know that feeling, right?
Mm.
Like when you're super excited for something, maybe concert tickets, and then you see the line, it's huge.
Oh, yeah, that sinking feeling.
Or maybe, look, you've had a sports injury, and just thinking about waiting months to get back out there is just crushing.
Totally.
Well, imagine that wait isn't for something fun, but for surgery you actually need. In Canada, way too many people are facing these incredibly long waits for planned surgeries.
Mm-hmm.
And it's a growing problem. It really impacts lives, Keeps people in pain. Maybe they can't work, can't do their daily stuff.
It's a huge challenge, absolutely resonates across the country. And to try and deal with it, some provincial governments are looking more and more towards private surgical centers as like part of the solution, maybe?
Right, PSCs.
Exactly. But that immediately brings up big questions, doesn't it? Like, what are these centers? How do they actually work inside our public healthcare system? And maybe most importantly, how do we figure out if they're really helping?
That is exactly what we're diving into today. So when we talk about these private surgical centers, these PSCs, we mean places like the Cambie Surgery Center in Vancouver.
Okay.
It's a multi-specialty place, been around since like 1996, actually. They do all sorts sports medicine, cosmetic stuff, general surgeries.
Wow, quite established then.
Yeah, they've treated over 90,000 patients. They can handle same-day stuff, but also things needing an overnight stay.
Right.
Now, here's the key thing, the distinction.
Mm-hmm.
Even though they're called private,
Mm-hmm.
a lot of them actually contract with the provinces. They do publicly funded surgeries.
Right.
So for those specific procedures, you, the patient, you don't pay.
Mm.
And you usually get assigned from the public wait list. It's not about jumping the queue if you're coming through the public system for those contracted surgeries.
That's a really important point to understand, especially as provinces think about using them more. And, to properly assess if these PSCs are actually serving the public good, we need a solid framework. Yeah, so that's where we're going to look at them through this specific lens, something called the Quadruple Aim.
The Quadruple Aim.
Yeah, it's a really respected framework. Healthcare systems all over use it to try and improve quality. And it helps us look at 4 key areas, 4 different angles of impact. It's like putting on special glasses to see the whole picture, not just one part.
Okay, so Quadruple Aim, what does that mean for us, for the healthcare system? Break it down.
Think of it like 4 big questions we need to ask.
Okay.
First, how does it affect everyone's health overall? That's population health outcomes.
Got it. Population health.
Second, is it actually worth the money? Is it good value? That's cost and value.
Cost and value, okay.
Makes sense. Third, what about the people doing the work? Are the doctors, the nurses, the staff, are they satisfied, supported? That's provider satisfaction.
Right, the people actually in the system.
Exactly. And finally, fourth, what's the actual patient experience like?
Mm-hmm.
Are people feeling well cared for, recovering well?
Patient experience. Okay. Population health, cost, provider satisfaction, patient experience. Those 4 things.
Yep. Those 4 give us a really comprehensive way to look at these private surgical centers, to measure them properly.
Okay, so let's just kind of get beyond just, do they cut wait times?
Precisely. Each aim gives us a vital perspective. It helps us move past simple assumptions, look at the evidence, or sometimes the lack of evidence, especially when governments are thinking about what rules or mandates they should put in place for these centers.
Right. Let's start with the first one then. Population health outcomes. Seems pretty straightforward, doesn't it? Like, if more people get surgery, they need, say, for really painful ankle arthritis that just makes walking awful, and their health should get better, right?
Yeah.
No one wants to live with that pain, that limited movement. So if private centers just do more surgeries overall, that seems like a win for people waiting. More surgery equals better health.
Well, that's the basic idea, the intuitive argument. And there's some truth there. We know about this thing in healthcare called the volume-quality relationship.
Volume quality.
Yeah, think of like a chef who only makes, say, amazing pasta versus one who tries to cook everything. The specialist usually gets really good, right?
Yeah.
Consistent results.
Okay, yeah, makes sense. Practice makes perfect.
Kind of. So the more a surgeon or a center does one specific procedure, often, the better the patient outcomes. Private centers could specialize like that, potentially improve quality for certain surgeries.
Well, good.
Could. But here's the kicker, the surprising bit. Despite that potential, We actually have very limited, consistent evidence right now that directly compares patient outcomes. Like, how do patients really do after surgery in a private center versus a public hospital for the same procedure?
Wait, really? We don't have that comparison.
Not enough solid, standardized data across the board. We just can't definitively say that PSCs improve population health better or even safer than public hospitals based on current evidence. People sometimes worry about cutting corners in for-profit places to save money. And while really bad outcomes are rare for these types of elective surgeries, and the patients are usually healthier to start with, the lack of that comparative data, it's a big blind spot, a critical one.
Wow. Okay, so it's not just about doing more, it's doing it better, and we don't actually know if it is better yet. All right, let's move to the second aim. Cost and value. The money side.
Yep.
You might just think private. That's got to be more expensive.
Yeah.
But the argument you sometimes hear is the opposite, right?
Yeah.
That maybe they could be cheaper.
That's often the pitch. Yeah.
Like, because they focus on just a few types of surgeries, they don't have all the massive costs of a giant public hospital.
Yeah.
The huge ERs, the trauma teams, running tons of different departments, all that overhead.
Right, the indirect costs.
Yeah. So the argument is, for specific focused procedures, they could theoretically be cheaper for the system.
And that's a really compelling argument. You hear it a lot from proponents. However, when we actually look at the data that is available from some provinces, the picture gets, well, more complicated, maybe even surprising.
Yeah.
Well, recent data, for example, from a pilot project in Quebec, it actually showed the opposite. Things like a short colonoscopy, they were 2.5 times more expensive in the private setting.
2.5 times? Wow.
Yeah, like $739 versus $290 in the public system. And carpal tunnel surgery, that was 84% higher in the private clinic.
84%. So much for being cheaper.
Exactly. It's not a small difference. It's a pretty significant cost increase for the same procedure in those cases.
Okay. So that theory about efficiency, saving money,
Yeah.
maybe not panning out everywhere. What else affects the cost part?
Well, a huge issue here is transparency, or the lack of it. Governments often keep the specifics of these contracts with private centers secret. Like, how much are taxpayers really paying per surgery? It's often confidential.
So we, the public, don't actually know if we're getting good value.
It makes it incredibly hard to know, even for policymakers trying to make decisions. Then there's the issue people call cherry picking.
Cherry picking, like picking the easy stuff.
Basically, yeah. Or risk selection. Because they are often for-profit, private centers might prefer the healthier patients, the less complex cases, the ones less likely to have complications.
Okay. So what happens to the others?
They end up in the public hospitals. The sicker patients, the ones with multiple health problems, the really complex needs, they stay in the public system, which then has to handle the higher costs and complexity.
So it shifts the burden.
It can. Alberta has tried to manage this, having the health regions assign patients to try and make it fairer, but it's a constant concern. And one more thing, upselling.
Upselling, like when you go buy a phone and they try to sell you insurance.
Kind of. Private centers sometimes offer patients premium options that aren't covered by public insurance, like maybe special lenses for cataract surgery. They might be nice for the patient, but the patient pays extra out of pocket.
So it creates like a little bit of a two-tier thing even within the public system.
Potentially, yeah, for certain extras. So the cost picture, it's definitely not simple.
No kidding. Okay, let's shift gears to the third aim, provider satisfaction. Which really means staffing, right?
Yeah.
The people doing the work.
Exactly.
We know there's a limited number of nurses, surgeons, anesthesiologists, all the skilled people we need in healthcare.
A very real shortage in many areas.
So if these private centers open up or expand, they need staff. Where do those people come from? Are they like bringing new people into healthcare, or are they just pulling experienced staff away from our public hospitals, which are already stretched thin?
That's the million-dollar question, isn't it? And it's a critical concern. Many critics argue exactly that PSCs just increase the competition for this finite pool of skilled staff, especially nurses.
Right.
And if experienced staff leave public hospitals for private clinics, it could actually make wait times worse in the public system. It strains the resources there, could lead to burnout for the staff left behind.
That makes sense. So do we know why staff might move? Is it better pay?
Yeah.
Better hours?
Well, here's another surprising gap. We don't actually have a clear, consistent picture of why nurses or other providers might choose private over public. Is it money? Is it, better shift flexibility, a less stressful environment maybe, with less complex cases, different opportunities?
Who's going to track that?
Provinces generally don't track this kind of detailed workforce data routinely, so it's incredibly hard to spot where the vulnerabilities are or understand the real reasons people move or figure out how to best support our healthcare workers across all settings.
Wow. So we're kind of flying blind on that, too. That seems risky.
It makes proactive planning very difficult.
Okay, fourth aim, patient experience. What about how patients actually feel about the care they get? You think this would be, like, front and center, loads of info, right? It seems so basic for something like surgery.
You would absolutely hope so. It seems fundamental. Yet, another striking data gap here.
Oh.
Really. There's very little consistent evidence comparing patient satisfaction or their overall experience between public hospitals and private surgical centers.
How is that possible?
Well, organizations like the Canadian Institute for Health Information, CIHI, they used to collect more patient-reported experience measures, things called PREMs, but maybe surprisingly, that program has actually been scaled back in recent years.
Scale back. Why?
The reasons are complex, but the result is a significant blind spot. We just don't have enough standardized information to really compare patient experiences properly across these different settings.
So we don't know if patients are generally happier or feel better cared for in one place versus the other.
Not based on robust, comparable data. We're missing a really crucial piece of the puzzle when we try to understand the total value and impact of private centers. It's hard to make patient-centered decisions without actually, hearing the patient's voice systematically.
Okay, this whole deep dive makes it super clear. Private surgical centers, they're not some simple magic fix for wait times in Canada.
Definitely not simple.
Yeah, they might offer faster access for some people, which is good. But they also bring up these huge questions about the real costs, where the staff are coming from, how transparent everything is, and if patient outcomes are truly better or just different. So if provinces are going to keep using them, and it looks like they are as part of the plan for wait times, what should they do? Like, what needs to happen to make sure these centers actually benefit the whole system, not just, certain groups?
That's the critical question. And if we connect all these points we've discussed, the experts looking at this say that for PSCs to be truly effective and accountable and transparent partners in our healthcare system, provincial governments really need to mandate 5 key things.
Mandate, like make them required.
Exactly. Think of them as essential rules of the road, guardrails for quality and fairness.
Okay, what are they? Lay them out for us.
All right. First, mandate standardized quality measures.
Standardized quality.
Yeah, make sure private centers collect and report the exact same kind of data on patient outcomes as public hospitals do. Things like, how many patients end up back in the ER soon after surgery? Or do they need another operation because something went wrong?
So everyone uses the same scorecard, apples to apples.
Precisely. So we can actually know which setting is performing better for patients. No more guessing based on patchy info.
Okay, that makes total sense. What's second?
Second, mandate patient-reported health outcomes, or PROMs.
PROMs, like asking patients how they're doing.
Exactly. Consistently collecting information directly from patients after surgery about their pain levels, how much they can move now, if their symptoms actually got better.
Yeah.
Right now, it's often only done for big things like hip and knee replacements.
Right.
It needs to be expanded to cover other common day surgeries, especially those contracted out to private centers.
Yeah, that seems vital. It's not just about the surgery being technically okay, but did it actually improve the patient's life?
That's the core of it. Okay, third, mandate the collection of hospital costs.
Hospital costs. Wait, you mean the public hospitals need to track their costs better?
Yes. Require public hospitals to really accurately track their own costs for specific surgeries, including all the direct costs, but also the indirect ones, the overhead we talked about.
Why is that so important?
Because that information is absolutely crucial for governments. It helps them negotiate fair prices with the private centers. If you don't know what it costs you to do it yourself, how do you know if you're getting a good deal from a private provider?
Gotcha. Leverage.
And it helps understand where taxpayer money is genuinely best spent. Some provinces, like Quebec and Ontario, are starting to use better methods for this, but it needs to be standard practice everywhere.
Okay. Makes sense. What's number 4?
Number 4 relates to the staffing issue we discussed. Mandate data collection on surgical workforce health.
Okay, so tracking the people.
We just need to know more about our healthcare workers. Provinces should be regularly collecting data on nurses, surgeons, anesthesiologists, like why they might leave a public hospital for a private clinic, or vice versa, or why they leave the profession altogether.
So finding out the why.
Yes, to identify staffing weaknesses, understand what keeps people in the job, address problems, and make sure we have enough skilled professionals everywhere they're needed.
Right, so we can actually respond effectively, not just react when there's a crisis. Okay, makes sense. What's the last one? Number 5.
Finally, number 5, mandate the collection of patient experience measures, those PRIMs we mentioned.
Back to the patient experience.
Absolutely. Governments must collect consistent, standardized data on how patients experience care in both public and private settings. Routinely survey a good sample of patients. We need to genuinely understand if patients are getting better care or having better experiences in one setting versus the other.
So basically fill that data gap we talked about.
Exactly. Without this kind of fundamental data on quality, outcomes, cost, workforce, and experience, we're making huge policy decisions affecting everyone's healthcare kind of in the dark. We're missing the voices of the very people the system is supposed to serve.
Wow. Okay, this deep dive really hammers it home. When we're talking about something as vital, as personal as healthcare, just like hoping for the best, not good enough.
Not nearly enough.
Having clear, unbiased, and especially complete information is absolutely essential. We've got to look past the simple promises like just faster care and really demand the data to make the smartest decisions for everyone in Canada. Make sure our whole system stays strong and fair.
So what does this all mean for you, listening to all this, as we try to figure out these really complex healthcare choices, balancing that urgent need to cut wait times with the long-term goal of building a system that's not just accessible, but also transparent, fair, equitable, and actually delivers the best possible results for everyone? Consider this. Is just being faster the only way we should measure success? Or should we be demanding the same level of accountability for quality, for cost, for how patients feel, for how staff are treated across all providers, whether they're public or private? It's a big question, needs careful thought. And as we've definitely seen today, it needs much, much more data.